there is a belief within the health promotion field that that you can't, you have to dumb down your intervention program to work with an organization. In other words, that an organization doesn't want your health promotion program. They want a fraction of it instead. They don't want the whole thing. Just, you proposing an hour intervention, they only want 15 minutes because everybody's time is precious. But that's not really the case, because there are hundreds of studies out there where people have taken and they've done really good, strong RCTs in organizations. They've been able to work with organizations. So I think one of the biggest problems out there that has to be overcome is this belief that organizations are unwilling to actually implement a full program. And I think once you can kind of get over that, then maybe there might be ways of working with organizations to adjust and change their organizational structure. One of the studies that I reviewed in my burnout webinar last week was really interesting. It looked at interventions for reducing burnout in the workplace. And this one systematic review compared individual level strategies, in other words, CBT, increasing job skills, that kind of thing, versus organizational changes. There was reducing work time to something that's much more manageable, increasing supervision, and increasing job control. And what they found was that the individual interventions didn't work at all, whereas the interventions that actually did target the organization, they worked a lot. They worked fairly well. So that just goes to show that organizations are willing to change. But the thing is that I think researchers and intervention specialists, they can't go in with the attitude that the organizations won't do it. They have to go in with the organization that how do we get these organizations to do this in a way that is meaningful and robust, that leads to a meaningful and robust evaluation. And if one organization doesn't want to do it, then let's try another organization, and because it's that, or if the organization doesn't want to do it, they really don't care about their individuals, their individuals' well-being. They're just there to check the tick box, on the program. That sounds harsh, but I've been doing this for a while, and I think that that's probably at least a fairly fair assessment.